Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I begin, I want to alert Albertans that AHS has received reports of some people over 75 receiving phone calls telling them that they can book their COVID-19 immunization for a fee. This is not a legitimate claim. This is a scam. Due to limited vaccine supply coming into the province, we are not yet able to offer the vaccine to all Albertans over the age of 75. When we do, the vaccine will be free of charge. Neither AHS nor any other community provider will ever be asking for payment for the vaccine. If you receive these calls, please hang up immediately and report to the non-emergency line of your local law enforcement. Turning to today's update, due to a technical issue that was identified in routine quality assurance checks, about 6,000 lab tests were not included in yesterday's update. This was a one-time error that only affected our public reporting, not the notification of any positive cases. This issue has now been fixed, and we are including them in today's update. As a result, we are reporting 582 new cases in the province. This includes 421 cases, which were identified over the last 24 hours. The change to yesterday's numbers will be reflected on our website, and the overall positivity rate did not change yesterday. Yesterday, we completed more than 11,500 tests, and our positivity rate is currently about 3.6%. Looking to schools, there are currently active alerts or outbreaks in 304 schools, or about 13% of schools in the province. Currently, these schools have a combined total of 763 cases. We continue to see a decline in our hospitalizations, which benefits every Albertan. There are currently 517 people in hospital, including 93 in the ICU. Sadly, 13 new deaths were reported to Alberta Health over the last 24 hours. My condolences go to the family and friends of these Albertans. We can never forget that these numbers represent human lives lost. These aren't just statistics. These were people who leave behind grieving family members, co-workers, friends, neighbors, and community members. All of our efforts are to limit the spread of COVID-19 and in turn to help more families from going through the pain of having a loved one in hospital, in ICU, or tragically losing a loved one to this virus. We have now detected 68 variant cases in the province. Unfortunately, out of the 11 new confirmed variant cases yesterday, all of which are B117, or the strain first identified in the UK, 7 of these currently have no known link to travel. Investigation is underway with detailed follow-up of all these cases and their contacts. 2 of the new cases, which are travel-related, have been identified as having potentially exposed 2 additional schools in the Calgary zone. As I mentioned in previous updates, these individuals did nothing wrong, and unfortunately, the exposure was the result of a overlap in incubation and quarantine periods. In the schools that we identified exposures in earlier this week, I am happy to report that there has still been no spread detected within any of these classes despite enhanced testing. However, with these 2 new schools, as before, it is important to know that anyone who may have been exposed was already quarantined after the initial COVID positive test. We are now offering all close contacts the chance to get tested twice as a precautionary measure. We are actively reviewing the literature and experience around the globe to assess if additional measures are needed in schools and other settings in the weeks ahead. Evidence is still emerging, but we are watching closely. If we need to make changes, we will do so. Today, I'd like to end by talking briefly about vaccine safety and what the emergence of new variants means for our vaccines. So far, we have administered more than 112,000 doses of vaccine in the province. More than 21,700 Albertans have now been fully immunized with 2 doses. We continue to monitor every dose administered for any adverse events. And so far, we have not seen a significant increase in the rate or severity of reactions. For more than 112,000 doses, there have been 53 adverse events reported. This rate is on par with this year's pneumococcal vaccination program. 11 of these events were an allergic reaction, and these individuals will see an allergist before getting their second dose. The most common other reactions have been symptoms such as swollen lymph nodes, diarrhea, vomiting, or a rash. We are posting daily updates online, and I will continue to share them with you because I know it's important for Albertans to understand that we are closely monitoring the immunization program and that no safety signals have been reported with either vaccine. Current evidence from around the world indicates that these vaccines are safe, and the benefit of being protected from COVID-19 outweighs the very rare risk of a minor adverse event. In addition to the Moderna and Pfizer vaccines currently being administered, Health Canada continues to rigorously review other vaccine candidates and will approve those that are found to be safe and effective. When it's your turn to receive the vaccine, I ask that you make the choice to be immunized. Whether you're doing it to protect yourself, your family, or perhaps those you don't even know, your immunization will save lives. As we wait an increased and stabilized vaccine supply, I know many people have questions about how these vaccines work on the new COVID-19 variants. As you know, several new strains of the SARS-CoV-2 virus, or the variants that we are talking about, have been identified in Alberta and around the world. These variants are similar to, but more infectious than the strain we've experienced so far. Evidence is still emerging on the effectiveness of the vaccines on these variants. It's important to remember that the Pfizer and Moderna vaccines are only a few months old, just like the variants. There is much we do not yet know, though researchers around the world are investigating. Early investigations so far appear to suggest the current vaccines may be somewhat less effective against some of the new variants in terms of preventing all symptoms of COVID-19. However, even against the variants, these vaccines still appear to be extremely effective at preventing severe cases, hospitalizations, and deaths. Again, research is still emerging, and there are a large number of vaccines being developed as we speak, so we will continue to watch the emerging literature closely. However, this is a positive sign, and one that we can all take hope in. At the same, it is also a reminder that we cannot simply wait for the vaccines to arrive. As a number of people have said recently, viruses can't mutate if they don't replicate, and variants can't spread if we don't give them the opportunity. I know it isn't easy, but we need to keep focused on following the measures in place and trying to limit in-person interactions whenever we can. We need to harness our collective power to prevent cases from rising, so we protect one another and the healthcare system and continue to keep each other safe. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Kevin Nimick, CTV.
Hi, Dr. Hinshaw. Is it fair to say the UK variant is now spreading in the community? And how many community spread cases do we need to see before either further restrictions are introduced or the planned February 8th loosening is canceled?
We have had community spread identified since we identified our first small number of cases with no known links to travel. And so what we're finding in these additional cases is some additional locations where that is true. That is, of course, concerning, but I do need to remind all of us that we are currently able to test almost every single positive COVID case for variant strains. And so that does help us detect more that are out there so that we can contain them. And it's important to remember that the reason that these new variants are of concern is because of their increased potential for spread. So when we're able to identify them, we can put interventions in place to prevent that from happening. And again, we have seen in several places that while we've identified the variant, we have not seen further spread onward because of the interventions that are in place. So we don't have a set number or threshold for number of variant cases that would impact our decisions with respect to taking the next step forward that would happen on Monday. What we are watching closely is whether or not we are seeing an increased transmission rate. That has not happened. Our numbers remain very small of the variants, and it is a good thing that we're identifying these particular cases so that we can prevent them from spreading further, and so that we can ensure that we know exactly what our current situation is. The variant cases still represent a very, very small proportion of our cases. And by finding out about them, again, then we have the means to do something to prevent any kind of onward spread.
Operator, can you put through the next question, please?
James Keller, Globe and Mail.
Hi, Dr. Hinshaw. I'm wondering if you saw the projections that were released in Ontario today, some pretty stark projections about the variants. I think they're projecting it would be over 80% of all cases by March 15th on the current trajectory. What do you think the situation is in Alberta, given that right now I think we have, per capita more cases of these variants than even Ontario does?
One change I would make to the statement you just had is that we have identified more cases per capita than Ontario. Again, as I mentioned, we are testing at this point almost all of our current positive cases, and we're hoping to be able to expand lab capacity to be able to screen every single case for the variant. So it's important when we're looking at different provinces to remember that what you're comparing is the cases that have been found, not cases that may or may not be present. It is, of course, important to be cautious, and we know that with these new variants, there is that potential for increased spread. So as we're looking over the next several weeks, we're going to be making sure that any impacts on the transmission rates in our community, our positivity rates, or our daily new cases, that will be part of the assessment in terms of determining whether or not we can continue to take steps forward or whether we need to pause or even take a step back. And I want to reiterate that the measures that we have in place with respect to public health, the distancing, masking, the regular things that we're asking all Albertans to do every day, those are the things that will protect us. And if we do them rigorously, we can prevent the variant from spreading and from becoming the dominant strain.
Operator, can you put through the next caller, please?
Jesse Weisner, Globe.
Hi, Dr. Hinshaw. Thanks for taking my question. Wondering why it took weeks before parents and students were notified that a positive COVID-19 case was a case of a variant, and whether that's concerning to you. And also, how long after a case is confirmed as positive does it undergo the testing for mutations of the variants of concern? And if it's not immediate, doesn't that undermine efforts to contain the case and the close contacts?
In the particular case that was identified yesterday as a variant case, it did take some time before that positive result was screened for the variant. It's important to remember, if we go back just 1 month, at the end of December was when we learned of the issue with respect to the increased transmissibility of the variant first identified in the UK, the variant first identified in South Africa. And so if you think about the fact that the lab has, in just a handful of weeks, been able to ramp up their ability to screen for these very specific mutations, it's quite remarkable. And a couple of weeks ago, when this case was first identified as being a positive COVID case, we weren't yet at that point to be able to rapidly screen all of the tests. So at the moment, we are improving our ability to move positive cases quickly through that screening protocol for variant mutations, and the time frame, therefore, will be improved as we go forward.
Operator, can you put through the next question, please?
Julia Wong, Global News.
Hi, Dr. Hinshaw. Your predecessor as Chief Medical Officer of Health and the Edmonton Zone Medical Staff Association's Pandemic Committee sent an open letter outlining serious concerns about reopening on Monday. They say other lower-risk activities should have been eased instead of the ones scheduled for Stage 1, and they say the activities allowed in Stages 2 to 4 are alarming and could cause super-spreader events. What do you say to their concerns, and could the activities allowed in each stage be changed?
As I've said before, there is no one right way through this pandemic, and there are a diversity of perspectives about how best to manage our situation. We know that when we look at neighbouring provinces of BC and Saskatchewan, which at the moment have roughly similar per capita rates to us, they have been operating for quite some time with very similar frameworks in having limited fitness activities and limited indoor dining. And so I think when we look at our own situation, we need to make sure that we're looking at the evidence that we have. We're looking at the real-world evidence of comparator provinces. And we are remembering that just because we are taking this small step forward on Monday does not mean that we are fully opening those sectors, and that each small step does need to be evaluated over a 3-week period to determine whether or not those openings have caused any additional spread. And if yes, then unfortunately we may need to pause or take a step backward. And so that is what we've always said with respect to this framework, is that it's constantly being evaluated, and that our best ability to increase slowly the number of activities that we can participate in is to make sure that all of those public health guidelines are followed in every setting, every day, by all of us.
Operator, can you put through the next caller, please?
Rafi Bouchikanian, CBC.
Hi, Dr. Hinshaw. As you move toward reopening, while we're seeing some increases in these more contagious variants, would you consider testing more Albertans and restart asymptomatic testing, as well as do rapid testing in schools, just to kind of be able to counter whatever increase we might be seeing in the community?
We are looking at options of expanding our use of rapid tests now that we have well established their utility in the rapid evaluation of people who have symptoms. We are looking at the possibility of using rapid tests in certain congregate settings where we might be able to use them in a regular screening approach. It's important to remember that those rapid tests are not a replacement for the PCR test, particularly when you're testing someone who has no symptoms and no exposure, and that even when they're used in other settings, a negative result on those rapid tests is not a free pass to be able to not follow all the other public health precautions. So that would be in addition to, not in replacement of, any of the other measures that we have in place. So we are looking at the potential for using those tests again in different settings where there may be risk of spread, and we're currently assessing the feasibility of different options.
Operator, can you put through the next caller, please?
The next question comes from Dean Bennett, Canadian Press.
Thanks. Hi, Dr. Hinshaw. I think you had a chance last night to talk with some gym and fitness center owners. They're looking for, I think, more of a roadmap to reopening, saying that a lot of them won't be able to survive past April, I think. What is the situation with them? What did you tell them, and what are their prospects?
We've heard from fitness and also other small businesses about how difficult these restrictions and the past year has been for them. And particularly for the fitness industry, which has had a lot of time, unfortunately, under closures or restrictions. We did hear from them last night that they are struggling. What we said to not just those fitness operators, but to other small business owners and sectors that were on the line, 2 things. First of all, the best chance we have of being able to slowly increase the amount of activity that can happen in different settings is to show that with each small step forward, we can continue to keep our trend downwards with our new cases, with our positivity rates, with our hospitalizations, and that if we're able to do so in each of these sectors, slowly, step by step, we'll be able to allow additional activities. The other thing that we wanted to make clear is that we are being very thoughtful about how we balance the needs of Albertans and the minimizing of risks of COVID harms and the minimizing of risks of the harms of the restrictions. And so we're definitely wanting to support those small businesses to make sure that they understand what they need to do to get ready for any future next steps, and for all of us, again, business owners or otherwise, to encourage their colleagues, their clients, and fellow Albertans to maintain these public health measures, even though it's difficult, because that is the only way that we will, in the next several months, be able to continue taking these small steps forward.
Operator, could you put through the next caller, please?
Carrie Tate, Globe and Mail.
Hi, Dr. Hinshaw. You mentioned that there were kids at school while they were potentially infectious, but that they also followed the rules. Does this mean the rules need to be changed, or that they're too weak?
Well, there's a couple of changes that are already being made. One of them is coming very soon, which is that every returning traveler from international travel will be required to be tested, and that they will need to be tested when they arrive and then tested at day 10. And that will be incredibly helpful because sometimes, and we've seen this in our border pilot program, people may not have symptoms, and so they're following the quarantine rules, but they may in fact have been infected, not know it, and potentially be able to pass it on to someone else. So that is one change that is coming, is that rigorous double testing. And that's one of the reasons that we have continued with our pilot program in the short term until that federal testing program comes into place, so that we can get as many people as possible tested twice after they come back from international travel. And the other change that we have made is seeing that transmission within households is very easy. And so, as I've mentioned on a couple of occasions this week, we have indicated that isolating at home is no longer something that we feel is appropriate for people who have a variant case. And so we have made some changes to that protocol. And as our labs have now been able to speed up this process of variant screening, we anticipate that the time between someone being diagnosed with COVID and when we would know if they'd screen positive for a variant is going to be much shorter going forward, to enable some of these new protocols to have more impact.
All right, there's only one question left in the queue, so operator, please put through the final question.
Lauren Pullen, Global Calgary.
Hi, Dr. Hinshaw. Thanks for taking my question. Just to follow up in reference to that case that was identified yesterday, that was a historical case that needed to be looked at before it was discovered to be a new variant. Are all those who were exposed now back in quarantine along with their families, as per that new protocol that has been announced by the province? And what is your level of concern that it was found from a few weeks ago, but again identified as a new variant just yesterday? And do you have any update on the 4 cases at the daycare? Is there any additional spread there, and can you release the zone yet?
So with respect to the question about how those school contacts are being managed, it's really important to remember that we have not changed the quarantine period. That remains 14 days from the last exposure to an infectious case. And so school contacts of those particular students who we just identified yesterday, those school contacts would have completed that 14-day quarantine, and that again is not extended. What has changed is if somebody is infectious and they have a variant of concern, we are saying that their close household contacts, the people that they live with, they would not be able to start that 14-day quarantine period until that individual, the case, is either isolating somewhere else other than the household, or that case is no longer infectious and they've completed their isolation period. So the school contacts just have that 14-day quarantine because they were not living with those cases. They were simply in school together. And so that the quarantine period has ended. We are offering testing to those individuals as well as their household contacts. Again, I want to emphasize that in the school exposures that we've previously identified, we have not seen in-class transmission. And we are doing this to make sure that we are taking every precaution. However, at the moment, we are not requiring those students to go back into quarantine because they have completed that required quarantine period. You asked about concern regarding the length of time from the original test to the variant of concern. That is, of course, a challenge. And as I mentioned, the lab has been working very hard over the last several weeks to improve the speed of the variant screening. And so going forward, there will be more rapid turnaround between that first positive test result and when the screen result will be coming back. And there may have been a third question.
If she was asking for an update on the daycare.
Oh, the daycare. Sorry, I didn't write that down. So we can now identify or pass on information that the daycare is in the Edmonton zone, and all of the individuals associated with that daycare have now been contacted. And at the moment, I do not have any information about whether or not there is any additional variant spread that's been identified at that location, but additional testing is underway, and the protocols relevant to variants of concern have been put in place with respect to those who are cases and close contacts at that particular daycare.
Thank you all for joining us. Dr. Hinshaw will provide another update on Monday afternoon. Have a safe evening.